All right, so we're at week 7. I went ahead, just in case you had not seen the mini session, I went ahead and put the link, the YouTube link into the chat. I also wanted to kind of check in with everyone. I did reach out to Mrs. Shrooms, the program director, about the PowerPoints, and it's not just happening to you guys, it's happening and throughout a lot of courses. So we are checking with like the head person to kind of find out what's going on. So thank you for like just letting us know, but we are addressing it. And keep in mind that you can get access to my PowerPoints. I know that you guys really like these. I will see what I can do, if maybe I can kind of like download the next couple for you guys and see if I can kind of like put them maybe in announcements. I can go through and try to get all of them and just have them in one section. I'll try to do that today, and then hopefully you guys will be able to, have access, but we are working on that. Okay. I was like, luckily it's week 7. Hopefully you guys have had access before. And then this is something that kind of just came up. So again, we are working on it, but I do want to thank you guys who have reached out because that is big. Okay. We have chapter 15. We're going to be talking about gram-negative cocci and spirochetes. I think I said that correctly. And then we're going to wrap it up. Now, before we get into that, I do want to remind everyone that there are no classes on Monday, 26 May 2025. Our Monday class has been rescheduled to Wednesday, 28 May at 6:10. So everyone that can attend, just know it will be on Wednesday. Now keep in mind, I'm still going to record it and I will have that archive up that night. So if you're not able to attend, don't stress. Just make sure you complete those discussion forum questions. But if you are able, Wednesday, 28 May at 6:10 p.m. Pacific Standard Time. Okay. For our quote of the week, your present circumstances do not determine where you can go. They merely determine where you start. Now, I want you to think about that. It reminds us that no matter where we begin, our circumstances do not define our potential. The journey ahead actually depends on the actions we take and the determination we have to move forward. For us as surgical techs, this is a very powerful message because no matter your current challenge, each step of growth and development can open up new opportunities, especially in our field. You may be nervous when you first get into your first case, right? But then you may realize that you really love one particular service over another. So keep pushing forward with each lesson and skill you gain. With that, I've got some questions from our mini session. And again, if you haven't seen it yet, that's okay. Okay. Now I want you to look at these photos for those of you who have seen it. And for those who haven't, take a guess. Okay. Which one is an image of Brucellosis from the mini session? Can you tell what it looks like just by looking at it? So in the mini session, what I did do is for each um just each item that I described, I had the actual image of it, okay, as I went into it. All right. Now, this is actually here, B. Now, the one thing about them is they infect the body through breaks in skin, mucosa membranes, ingestion through unpasteurized milk, or inhaling aerosols. Now, A, which is right here, is a protobacteria. It is a large group of gram-negative bacteria. And C, right here, is the genus Kingella. It's a part of the beta protobacteria class and the Neisseria family, including Kingella, and different things like that. Okay. Now, the next question I have is a true or false. Providicina strudeli is commonly found in animals such as cats, dogs, birds, sheep, and reptiles, where it typically causes severe infections in humans. True or false? That is correct. It is actually false. Now, I'm going to explain to you why. Now, it is commonly found in animals, cats, dogs, birds, sheep, and reptiles. But the key word here is typically causes severe infections in humans. It usually lives harmlessly on us, on the hosts, I should say. It can become infectious in humans under certain conditions, but it's not something that's usually going to cause us severe infections. So that is why the statement is false. So if you first read it and you're like, oh yeah, it's on cats, dogs, birds, and sheep, that's correct. But we look for these little keywords here, severe infections. Okay. See how they get us? All right. Now we get into chapter 15. Full disclosure, I do have images as we are in micro, and you guys are going to be surgical techs, but I just wanted to let you know. Okay. With that, we have some learning objectives, right? Again, key terms. We're going to look at characteristics. We are going to talk about the methods of transmission. We're going to also compare and contrast and look at the prevalence, clinical stages, and long-term effects of syphilis. And then we're going to do a group class discussion and bring it all together before we get into some poll questions. But before that, let's get into some significant clinical issues that we really need to know. One of the more difficult aspects for us is witnessing the devastating effects disease process can have on patients, especially when they come into the operating room. You're going to see things, you're going to be in cases where you are doing palliative care. And palliative care is where we are just giving that family a little bit more time, okay? Because of the disease process has gotten to a point where, right? So, knowing that some of the infections are STDs, which are preventable with the use of like protection, it would be easy to, of course, become judgmental and critical instead of keeping that focus on the problem at hand and how the patient became infected. So it's almost like you turn off your emotional feelings because now we have a patient in front of us. Pregnant females may have irreversible damage from pelvic inflammatory disease, PID, or infect their fetuses, resulting in permanent damage in utero or, unfortunately, during delivery. For us, it's really important to understand the complexities of all of these diseases. Keep in mind that nobody intentionally becomes infected, and realizing that many honestly may not even recognize that they have been. So we have to kind of go in there and any bias that we may have had, we try to change that, okay? The perception, and then we try to focus the attention on taking care of the patient with the same dedication by all members of our team as any other patient would deserve and should expect, because you will see a lot. You're going to have, some of you may have the experience of getting a patient that needs a foreign object removed. And the circumstances are going to be a little bit um, different. You may have patients that are going to be under police um, watch and they were involved in something crazy. You may have to remove bullets and knife blades and all kinds of stuff. So the biggest thing is for us to just focus on the job at hand. All right. that was the clinical significant topic, believe it or not. Now, the Neisseria family belongs to the group of bacteria called Proteobacteria. They're gram-negative, which means they do not hold on to the stain used in testing. So they appear pink under a microscope. Before I get into this, I do want to give you guys a shout out for your knowledge check and your quiz for last week. You guys did phenomenal, and I don't want to not give you guys your flowers, so keep that momentum. Okay, back. Now, with this, they are aerobic, which means they need oxygen to live. Most of these bacteria are spherical, but some are short and a bit more oval shaped. So you probably can't tell, these are kind of oval shaped, okay? Now, the key feature of this bacteria is the presence of endotoxins, which are harmful substances found in the outer layers of the bacterial cell membrane. This layer is made up of something called LPS, lipopolysaccharides. These endotoxins can cause disease by kind of triggering that inflammation that we already have in our body. Also, though, these bacteria have special structures that help them kind of stick to the tissues in the body, making it easier for them to, unfortunately, cause infection. Now, there are two main types that you guys need to know, and you've heard of them before. Neisseria meningitis. This bacteria causes bacterial meningitis, an infection of the lining around the brain and spinal cord. And then Neisseria gonorrhoeae. This bacteria causes gonorrhea, a common sexually transmitted disease, often referred to as the clap. Now, both of these bacteria have two important features that help them cause diseases. The pili, if you guys look, they have the tiny little hair-like structures on the surface of the bacteria that allow them to stick to the tissue in the body, making it harder for our immune system to remove them. Think of it like slime, okay? We can remove the slime, but it takes a little to get it off. Now, the slime doesn't have a protective layer. These have a capsule, a protective layer around the bacteria that helps them evade our body's immune system. With gonorrhea, you have pairs of round-shaped bacteria. They thrive in low oxygen environments and need extra carbon dioxide to breathe. It's always considered a pathogen, which means disease causing. Now, gonorrhea usually affects the genitals, the rectum, the throat, but early in the infection, the bacteria sticks to the mucus cells in those areas. Then they move into deeper tissues, causing the infection to actually spread. If it's not treated, it can also spread through the bloodstream, causing secondary infections that may appear as skin rashes, or you may hear them complaining of joint swelling. Now, gonorrhea is an STD, and its symptoms can include pain during urination, abnormal discharge, or even sores. And if it's left untreated, it can lead to serious complications. So, kind of something to think about. Like I said, I have some images for you guys, okay? Now, gonorrhea can sometimes remain unnoticed for months, silently damaging reproductive organs. In females, the cervix is typically the first place the bacteria will infect. Again, PID is a major complication if it's not treated, which of course can affect the reproductive organs in the abdomen. So a lot of times females with PID will have tenderness in the abdomen when it's touched. They're going to have severe chronic pain along with vaginal discharge. But PID can lead to other complications like salpingitis, inflammation of the fallopian tubes, and that's what causes that scarring. Oophorytis, inflammation of the ovaries, which can also lead scars and lead to infertility. Now, one serious result of scarring from PID is atopic pregnancy. Now, that's not saying every atopic pregnancy is a result. It's just saying that it can lead to. This happens when the fertilized egg implants in the fallopian tubes or elsewhere in the abdomen instead of the uterus. Now, as the embryo grows, it can actually rupture the fallopian tubes, which is an emergency situation. And these are the patients that we see in surgery because we want to stop the bleeding and remove the embryo. Additionally, if a pregnant woman has gonorrhea, she can pass the infection to her baby during a vaginal delivery. Now, if the infection is diagnosed before labor begins, then of course a C-section can be scheduled and performed just to reduce the risk of the baby becoming infected. Now, in males, gonorrhea most often infects the urethra, and that's the tube that carries the urine from the bladder. After an incubation period of about 2 to 5 days, then they'll have symptoms of uteral discharge, which is like pus-like abnormal fluid from the penis, and dysuria. That is painful or difficult urination. In some cases, though, gonorrhea can spread to the testicles, causing the infection and scarring. Now, this also can lead to fertility issues. So, just like it can lead to fertility issues in females, it can as well in males. And so it's really important because it involves the organs for producing and transporting sperm. Now, another form of gonorrhea is gonococcal pharyngeal infection, pharyngitis. Okay. This affects the throat. This can occur in anyone who engages in oral sex, which is if they engage with an infected person. Okay. Now, in rare cases, very rare, gonorrhea bacteria can spread through the bloodstream, causing disseminated infection. This can go in, and what it does is it attacks the joints, and that leads to serious life-threatening effects. So, how do we diagnose it? Now, if someone is sexually active and has symptoms, they're going to go to see the doctor. Okay. They're going to perform a urinalysis on them to detect if this is indeed gonorrhea. But they may also take swabs, the urethra in males, the cervix in females, the throat, or even the rectum if the person has engaged in oral or anal sex. Now, I have seen this question. The NAT test, which is nucleic acid amplification test, is the most reliable test for detecting gonorrhea and chlamydia. It has been approved by the FDA and is commonly used for screening. I will repeat that. The NAAT, the nucleic acid amplification test, is the most reliable test for detecting gonorrhea. Now, we look at antibiotics, which are the primary treatment for gonorrhea. However, over time, Neisseria gonorrhea has become resistant to several drugs, including penicillins, tetracyclines, and ciprofloxacin. So this means that doctors have to be careful when choosing the right antibiotic treatment. Now, Olfathema neotatrum is a gonococcal eye infection. Yes, you heard me correctly, an eye infection that can affect newborns. And so this is why we try to prevent patients or females that have gonorrhea if they're going to do a vaginal delivery, because it can get into the baby's eyes. And it causes serious eye problems, including corneal infection. They can get ulcerations on their little eyes. They can get perforations, which are holes in the actual cornea. Now, this is preventable by applying erythromycin ophthalmic ointment to the baby eyes right after birth. But all newborns, regardless of whether they are delivered vaginally or C-section, should receive some type of treatment just to prevent eye damage. In many states, this is required by law. So it's just going to depend on where you deliver. For me, when I was in San Diego, it was an option. Okay. It wasn't something that they just automatically did. They actually asked if I wanted it. Okay. Now, things to keep in mind with meningitis The infection affects the brain and the spinal cord lining. With septicemia, we're talking about an infection in the actual bloodstream. While about 10% of people carry the N meningitis in their nasal pharynx, so it's already there, or in the upper throat, most don't show symptoms. These asymptomatic carriers can still spread the bacteria through close contact. So, to protect against severe infections, people traveling to areas with high rates of N meningitis infections or recommended, like it's not required, but recommended to get the vaccine just to be safe. Now, a couple images, right? Keep in mind that this is a very serious inflammation of the meninges. The meninges are the protective layer around the brain and spinal cord. These diseases can develop very quickly and typically present with classic signs. So, fever, headache. What you see in front of you is stiff neck, nausea, vomiting, photophobia, which is severe sensitivity to light, confusion, and in some cases, unresponsiveness due to the change in the mental state. As the disease worsens, the inflammation of the meninges increases pressure on the brain. So it's almost like it's kind of squeezing it, leading to neurological problems. Fatalities can occur within hours of symptoms starting. So even if the person survives, think about that. They've had all this pressure on their brain. There may still be permanent brain damage or hearing loss. With meningococcal septicemia, this is a life-threatening infection, okay? And it spreads into the bloodstream. Again, you're talking about damage to blood vessels, leading to bleeding in organs, skin, and other tissues. But how does it happen? I know that's what you guys are wondering, right? Well, the bacteria enters the bloodstream through the nasal pharynx or the throat area, or through endocytosis, which is a process where the bacteria are engulfed by cells. Then it's released as endotoxins. Remember, those are harmful substances from bacteria's outer membrane. And then it goes in and it destroys and damages vessels and causes vascular inflammation, thrombosis, which is blood clots, disseminated intravascular coagulation, or DIC, where the clots occur all over the body and prevents normal blood flow. So you have a clot, blood can't get through. Another clot, blood can't get through, leading to severe bleeding and, of course, organ damage because they're not getting those nutrients. Unfortunately, death, well, depends. Death can occur very quickly, either from meningitis, septicemia, or DIC, usually within hours. Okay. Now, in cases where meningococcal septicemia doesn't lead to death, but it's still severe, treatment may involve amputation. Fingers, toes, or other extremities that have been damaged by the infection. In some cases, they'll come in to the operating room and we'll do a debridement. We usually do an irrigation and debridement because we want to get it clean as well. But debridement, where we are removing dead tissues, and it's followed by skin grafting to kind of cover that wound that we just kind of debrided and kind of scaled back to the healthy tissue. So we get signs, all right? Fatigue, general body aches, vomiting, diarrhea, chills, just kind of feeling cold hands and feet, which makes sense because they're not getting the blood circulation to those areas, right? Severe body pain. They might start rapidly breathing. Their heart rate can go up. They'll have red pinpoint rashes. They may also have dark purple rashes, which appear in like the later stages of infection. We also have what's called acute fulminating meningococcal septicemia, also known as Waterhouse-Friderichsen syndrome. You may see that again, Waterhouse-Friderichsen syndrome. Let me spell it because I want to make sure you guys see it. So I'm going to copy it and put this in here for you guys if you see it. There we go. Okay. This is acute fulminating meningococcal septicemia. Okay. This is a severe, I cannot stress, rapidly progressing form of meningococcal septicemia that affects multiple organs in the body. It has an extremely high mortality rate, close to 100%, making it a highly deadly infection. And just to kind of give you some reference, Ebola is another very high mortality rate. 1 in every 10 people survive. So kind of think about that. So 1 person out of 10 is likely to survive. Of course, there's outliers, right? But usually when 10 people are diagnosed with Ebola, 1 typically survives. So if you think of Waterhouse-Friderichsen syndrome, close to 100%, okay? Does that make sense? Kind of putting it into perspective. Okay. Now, we look at how meningococcal septicemia can kill faster than any other infectious disease process. So, of course, it's going to be important for them to recognize the signs and symptoms so that we can get in and treat the patient. Patients with meningococcal infections can present in a lot of different ways. Okay. Meningococcal meningitis alone, there's about 30 to 50% cases. Meningococcal meningitis with septicemia, 40% of cases. Meningococcal septicemia alone, 7 to 10%. Now, it is important to recognize meningococcal septicemia early, right? Because it can progress and become fatal more quickly than the other types of infections. So we get in there and we want to have immediate medical treatment to prevent systemic shock, which of course leads to death. So the chapter talks about a tumbler test. Now, this is a simple way to assess if a new rash might be meningococcal. Okay, so how does it work? You take a clear drinking glass, a tumbler, and press it against the rash area. If the rash spots remain visible through the glass and do not fade or blanch, meaning turn pale, it may actually be a sign of meningococcal infection, and you should seek immediate medical attention. Now, this test is particularly helpful for parents of like small children who may have had, they're not going to be able to express their symptoms. Now, there's also PCR test. It's a rapid diagnostic test used to detect meningitis DNA in the CSF, which is the cerebrospinal fluid. And this also confirms the infection. Now, the most common treatment of meningococcal infections includes antibiotics like penicillin G, or third generation, like cephalosporins. These antibiotics need to be immediately started to help prevent the infection from worsening. But patients with meningococcal septicemia often require extensive hospital care due to the severity of the infection, especially if it affects multiple organs. Okay. Now, if the infection leads to poor circulation and necrotic or dead or gangrenous tissue, they're going to come in and see us. We're going to remove the dead tissue because we want to get to the healthy tissue. So let's look at this first picture here. Okay. In the operating room, we're going to take all of this back as far as we can to get to the healthy tissue. If that means we go up to the wrist, we're going to go up to the wrist. The same in the foot. We're going to come back as much as we can to debriding, meaning removing that tissue until we get to a point where we're either going to have to stop because it's too much, or we're going to keep going till we get to healthy tissue. So we also try to keep the same team in those cases. Artificial skin grafts may be necessary, whether it's made of synthetic material or in this case, it's going to be synthetic because you're not going to want to take any more tissue from the patient because we're going to need to cover large areas of lost skin until the patient recovers. So we have artificial and autologous. Okay. Now, again, amputation may be necessary if the infection leads to severe tissue damage. So let's say we took this back and The finger tissue, it's necrotic to the bones because a lot of times that's what happens. Then we're going to have to amputate, and we're going to have to continue to amputate. Let's say we get in here and everything in that hand, like the outside may look like okay, potential, but when we get in there and it's necrotic, we're going to have to remove all of that. Okay. And that's why I say amputation may be necessary, but it's going to be delayed until the patient is stable. So we have the idea, we know the plan, but if they're not stable enough to do that, or it, like I mentioned, we go to a point where we can continue or we have to stop because of the patient's their current status. We have to make sure there is a clear line between healthy and dead tissue. And that's why we continue to go back until we can see healthy tissue. So that means that a lot of times these patients are constantly coming back. Okay. So just keep that in mind. In some cases, if compartment syndrome occurs, and you're going to hear that a lot, especially if you do ortho, even general, this is where pressure in a muscle compartment rises and it threatens the blood flow. So it'll look swollen, it'll be really tight. And what we normally do is what's called a fasciotomy, where we'll make an incision, we'll take usually long Metson bomb scissors, which you guys will learn in module 3, and we kind of just go through and open it up to kind of relieve the pressure. And what that does is it helps preserve circulation to the affected extremity or like the digits. Okay. Now, we look at Moraxilla. We talk about this one. It is a gram negative. It's non-motile, which means it's not moving all crazy. It's strictly aerobic, which means it's oxygenated to perform what it wants to do. And it is most well known previously as Neisseria capitis. It is the third most common cause of otitis media, which is none other than middle ear infections in children following, like, let's say they've had streptococcus pneumonia or even Haemophilus influenza. It causes around 3 to 4 million cases annually here in the United States. Believe it or not, though, it's also involved in adult sinusitis, bronchitis, bronchopneumonia, especially in older adults who have conditions like chronic obstructive pulmonary disease or COPD. Now, Moraxilla can cause pneumonia, which resembles gonococcal pneumonia. So you got to think about that. So that's why it's going to be really important to differentiate the two through laboratory tests. Up to about 95% of Moraxilla strains produce lactamase, an enzyme that deactivates common antibiotics. So, unfortunately, has a little bit of antibiotic resistance. So, it'll be a little bit antibiotic resistant to like your penicillins, your amoxicillins, and your ampicillins. There are some ineffective antibiotics, okay? Meaning that no matter what you give it, it's just not going to be able to break that strain. So the first line of treatment is amoxicillin, though. The second generation is a cephalosporin, which is an oral that can be given to the patient. Okay, but this all going to depend on one, if the patient already has an antibiotic resistance, or if it's even able for this antibiotic to touch it. Okay, so of course the patient would have to undergo different tests. We have spirochetes, from the Greek spira, which is spiral, and chate meaning mane. And it just kind of, if you look at it, describes the shape of it. So it kind of makes sense why they named it that. Now, this one can live in either anaerobic or aerobes. So it's a facultative. Okay. Here we talk about Treponema pallidum, which causes syphilis. Another one is Borrelia, Lyme disease, and Leptospiria or Leptospirias. So all those fancy terms: syphilis, Lyme disease, relapsing fever, and treponema. Okay. Now, if you look again, these are long, snake-like, and they do actually appear like tight coils under the microscope, resembling a corkscrew Or for those of us that remember the old telephone cords, kind of looks like that. Now, these filaments help the spirochetes rotate like a corkscrew, and they propel through the fluid, aiding in ability to move faster in high environments and kind of go in and penetrate tissues. Now, due to their extreme thinness, they may require dark fields just to be able to kind of clearly visualize them. First one we're going to talk about is Treponema. Okay. The growth requirement is a pH of 7.2 to 7.4. You may see that somewhere, and a temperature of 30 degrees Celsius to 37 degrees Celsius. This one requires low oxygen levels. Cells have a high lipid content, making them more resistant to environmental changes, so they can kind of tolerate a little bit of change. But there are some subspecies, venereal syphilis, endemic syphilis, non-venereal syphilis. Now, these diseases are collectively known as treponemites. They also follow distinct stages of progression. So you have your primary stage, okay? You have your secondary stage, which is where you start to see rashes and lesions. And then your latent stage, where there are no symptoms at all. But the fourth stage, so if you see a question, how many stages of treponema? Okay. The fourth stage is where there's organ damage. All right. Now with syphilis, it's a slow evolving disease with periods of rapid bacterial multiplication, followed by asymptomatic stage as the immune system kind of works to kind of control the infection. Now, the transmission is primarily through sexual contact, but also through blood transfusion, infected hypodermic needles, breast milk, and even saliva. The crazy thing about syphilis is that it can survive for only about 2 hours on surfaces. The primary and secondary stages of syphilis are actually curable with penicillin injection or a course of like tetracycline. Keep in mind, early detection is going to be important for all of these diseases that we're talking about, okay? And for preventing transmission to unborn fetuses during pregnancy. So, primary stage, 10 to 60 days after exposure, you might see a small, hard, ulcerous lesion known as a trance, CHNCRE, and it appears at the site of bacterial injury, usually the genitalia, but can also be in the mouth, right? Now, typically a single lesion, but in HIV or AIDS patients, you're going to see multiple lesions may develop. Now, the chancery can appear on your organs, anus, mouth. The lesions contain highly infectious fluids. And at this stage is when syphilis is the most contagious. So that is the initial stage. So keep that in mind. In the initial stage, syphilis is the most contagious. In the secondary stage, this occurs about 1 week to 6 months. Now, the bacteria spreads to other tissues at this point, including the central nervous system, which is often affected. So then you'll have a widespread rash, appears typically concentrated, but the concentration is going to be on the soles of the feet, the palm of the hands, the genitals, or even the mucous membranes. Now, the duration of the secondary stage can last 3 to 6 months and is marked by infectious lesions that contribute to transmission. Keep in mind, these stages highlight just how the progression of syphilis is and the importance of just early diagnosis and treatment to prevent further complications. So we get to the latent stage. This occurs between the primary and secondary stages, right? No obvious or visible symptoms, but Treponemas continues to invade tissues. The host may or may not even feel infectious during this period. But Pregnant women can pass the infection to their unborn child, leading to congenital syphilis. The infected individual may experience vague discomfort, but no clear signs of disease are like present at that time. Approximately 50 to 70% of individuals in this stage do not progress to the final stage, which is the late stage. This is the crazy one. For the late stage, it occurs 10 to 30 years after the initial infection. So we look at the tissue. Now, here they may have soft tumor-like growths. The disease at this point can affect any organ or tissue in the body. There's what's called neurosyphilis, and it involves the nervous system causing neurological symptoms. There's cardiovascular syphilis, affects the heart and blood vessels. There's syphilitic aortitis, where it's affecting the aorta, potentially leading to aneurysms or ruptures. This late stage represents the most severe stage of syphilis, and if left untreated, it can result in significant organ damage, disability, and of course, death. Now, when we talk about neurosyphilis, we're looking at the posterior sensory tract of the spinal cord. So they're going to have numbness. Their extremities because there's nerve damage. They have what's called tabes dorsalis. This is a condition marked by progressive degeneration of the spinal cord, leading to like a characteristic gait where it's like wide base and it's an unsteady walk. And they may have deformed knees. There's going to be some type of bony destruction. Okay. It is going to invade the skeletal system, leading to the destruction of bony tissue. As bones become weakened, they become more susceptible to fractures. But that's not all. There's going to be some type of facial disfigurement, nasopharyngeal damage, where the nasal and the palate bones are becoming damaged and lead to significant disfigurement. Now, there is Treponema pallidum pertinei, or YAWS. This is a non-sexually transmitted form. Okay. Unlike syphilis, yaws, again, is not sexually transmitted. You may see a question and they'll have all the different types of syphilis and they're going to say, which one of these is not sexually transmitted? Yaws is, which is so funny. YAWS. Okay. It typically affects children in tropical regions. Now, in hyperendemic areas, up to 75% of the population may be infected by age 20. Most cases occur in children from the ages of 5 and 15 years. Here we have the primary stage, again, begins with painless red papules known as mother yaw, where the bacteria enters the body through broken skin or mucous membranes. The lesions resemble raspberry-like papules. So scratching of the lesion can actually spread it because it gets into their nails and they go somewhere else. And this is usually around among children who often have poor hygiene. With the secondary stage is after a period of latency, similar to syphilis, the disease progresses to form internal and external lesions. The lesions can affect the skin, the bones, and other tissues. The infection may also spread to multiple areas, causing further destruction. With yaws, if left untreated, it can severely damage skin, bones, tissue, similar to the late stage of syphilis. Now, chronic stages of yaws may lead to, of course, disfigurement and complications like bone deformities, kind of like you see in the figure in front of you. Have a couple more. Borrelia. Now, Borrelia species are helical-shaped bacteria with 3 to 10 kind of like loose coils doing their thing and 15 to 20 axial filaments. They are thicker, they're less curved compared to Treponema species. Now, Borrelia and Lyme disease, kind of put them together. They're very large, they move easily through the body, our fluids, and our tissue. They have a slime layer, okay? Unlike other Borrelia species, Borrelia burgdorferi has a gel-like coating called slime layer. So it's literally a slime layer. It acts like an armor, okay, protecting it from our or the host immune system. Now, it invades healthy cells, causing the cell's own digestive enzymes to break down the cell. So it's like your own body's attacking itself. As it exits, it coats itself with portions of the cell, helping it to kind of like hide from or avoid immune detection, which is kind of crazy if you think about it. We look at Lyme disease. Lyme disease is caused by Borrelia, the most common tick-borne disease in the United States. It is transmitted to us through the bite of an infected deer tick, which thrives in bushy areas and tall grass. We have leptospiria. Now, these are thin, flexible, tight coiled gram-negative bacteria, making them highly motile. Now, these bacteria require oxygen to thrive and survive. Like others, they have a helical shape, but they are distinguishable by their hooked ends, which are characteristics of the Leptospiro genus. Now, typically, these are going to be exposure to the urine of infected animals, okay? Especially from dogs, domestic livestock like cattle, swine, and horses, and rodents. The bacteria are often present in the renal tubules of these animals and then are expelled through their urine. So you have sudden onset. It begins abruptly. The patient's going to have a high fever, severe headache. But there may be other symptoms, eye pain, photophobia, which is just sensitivity to light, and some cases of hemorrhagic rash. After a brief asymptomatic period where the patient doesn't really have any symptoms, which is about 1 to 3 days, the bacteria are cleared from the bloodstream and the body starts to develop a inflammatory response. All right, so here we are. We're going to work this out together. We have Daniel or Danielle, CST at an inner city hospital. They're advised of an add-on case of a diagnostic laparoscopy, which is where we take cameras and we're going to look in the belly, okay, for abdominal pain in a 28-year-old female with a past history of a sexually transmitted disease. As the surgeon inspected the peritoneal cavity, the appendix was normal. However, there were numerous abnormalities involving the fallopian tubes and the ovaries, and the surgeon requested that cultures be sent to the lab. So let's work this out. Let's get to our first question. What might the surgeon be seeing in the reproductive organs? Keep in mind, the doctor sees swollen fallopian tubes. We got to think about what kind of problem could that suggest. Could be a UTI. What are the fallopian tubes supposed to do? Okay. Also think about that. Is there anything that we learned today that would make us think that that could cause scarring? Do you guys remember PID? Had to think about PID, right? That could cause scarring on the fallopian tubes. We have to think of what could go wrong if they're inflamed or blocked. What is one thing that is a potential risk if a patient, a female, was to get pregnant and has scarring? What could happen? Exactly, ectopic pregnancy. So we think of inflammation, infection, I like that, Josh, and blockage or scarring. Okay. So so we're thinking pelvic inflammatory disease. Okay, they could have had in the past. Definitely infertility. Yes, you guys are right on it. What bacteria can cause this? Think about some of the things that we talked about. Two in particularly, two sexually transmitted diseases in particularly, treponema. Um, so we look at syphilis, could be, but more specific, gonorrhea and chlamydia. Okay, so in the Treponema family. Okay, both can be silent, which means no symptoms, making them especially dangerous. I was going to say damageable, dangerous if untreated. How might this affect her future? And someone already said it. How could this affect her future? Um, think about some of the symptoms that she could complain about. Could be. That's a good one. Do you think she's at more risk of infections? What about difficulty having children? And then one of the things that she may talk about is pain in her lower abdomen. Okay. We immunosuppressed system. I love that. Irritation in the abdomen. Yes, you guys are on it. I'm loving it. Now we know that early detection is the best, right? We already know that. But this one, how are these infections even spread? How do you think someone might get infection like this in the first place? I know this one's kind of like a no-brainer, like we know, but it's still good to kind of think about it. Sexually transmitted. That's right. Also, no symptoms equals no treatment. So if the patient kind of like, I'm fine, they don't think about it, you know, why might someone not know they're infected? Remember, no symptoms, so they're not going to think about it. If they don't have symptoms, it could be dormant, still doing its thing, but it's not physically causing them discomfort. And do I have another one? Yes. What might the pathologist see under a microscope? So this one, we're really just looking at bacteria, whether it's round or rod shapes, inside the cell, outside the cell. We look at, does it have a capsule? Does it not have a capsule? Is it tightly coiled? Is it more dispersed and spread out? Is it venereal or non-venereal? Okay. So just a couple things to kind of get us thinking. All right. You guys are doing phenomenal. Okay. Now, for those of you who are at home, we're going to not spend too much time, but I have some poll questions related to this live session and our mini session. Just some questions that I kind of like threw to reinforce what we've learned because there was a lot of information. Okay. I'm going to give you guys about 2 or 3 minutes. And for those of you who are watching, after about a minute, I'll go ahead and change to the next slide, and then we're going to wrap everything up. All right, I'm gonna go ahead and close off the poll really quick and share. All right. So again, for those of you who are watching or those of you who had not had the opportunity to kind of complete it, here are the questions again. Let me just go back one. So here are the first five, and here are the second five. What questions do you have for me? Looking. All right. So again, I just wanted to tell you guys how proud I am. Like when I went through your quiz, there were no highly missed questions on the quiz and only one highly missed question on the knowledge check. And micro is not one of those easier subjects. So I'm extremely proud of y'all. Keep up that momentum. We're at week 7. We're almost there. For those of you who are watching the playback, how can the unique characteristics of Treponema continue its ability to invade the host immune system during the infectious process? In what ways could early detection and treatment of, let's say, Lyme disease prevent long-term complications? And given that treponema can cause long-term damage if untreated, how might earlier intervention in syphilis affect both individual health and public outcomes? I do want you guys to remember that again, Monday classes are or the school is closed. There are no classes on Monday. We will meet for the first time on Wednesday at 6:10 for everyone that can make it. We went over gram positive. We talked about different diseases related to Neisseria, Treponema. We looked at gonorrhea. We looked at syphilis and the different stages of syphilis. We kind of brought it together in a case study together. Now, I encourage you guys to stay engaged. Continue just being phenomenal. Okay. Like I mentioned, micro, I like how you said that. Micro is no joke. And the fact that you guys are killing it is a testament to how hard you guys are working. And I'm so proud of you. Um, so if there's any questions that do arise, let me know. With that, you guys have a wonderful rest of your evening. Have a wonderful weekend, good holiday, and I look forward to seeing everyone who can attend Wednesday's live session. Good night, everybody.
Can I actually talk to you for a sec when everybody's gone?
Yes, ma'am.
Okay.